Rick, like an extra towel that they have, a blanket. Maybe a folded, maybe 3 foot by 3 foot. So as it raises the mattress, then it takes away that. Do you ever lay in a mattress and all night long you could feel your body,
sure,
and you're working against it? You're not going to sleep that well. And I think when you travel, you want to get a good night's rest because you're usually more active than you are at home, Rick. So, so put a towel underneath the mattress just to level the playing field.
How about pillows as well? Is there pillows you can use in the car? And I know you've talked about pillows before that can really give that neck that proper curve that we always talk about on the show.
Well, in a car, it's called a travel pillow, Rick. It's like a U-shaped pillow. When I fly on a plane, though I can't sleep on a plane, Rick, when I put that pillow behind me on a plane or even in a car, you can just sort of lean your head back, and because what happens in a plane or a car, Rick, let's say you're driving to Myrtle Beach. Cheryl's in the passenger. She falls asleep, no pillow. Here's her head after a couple hours. So Rick's driving along, and then Cheryl gets to Myrtle Beach with terrible headaches. So with the travel pillow, that's what it's called. You put like this U-shape, and it's going to keep the neck straight, so it's not going to be able to go to either side, and it's going to prevent the neck from misaligning while you're driving.
One thing you got right, my wife would be Sleeping by McAdoo.
Yeah.
You definitely got that right.
She trusts your driving ability.
Is that what it is?
That's what it is.
That's exactly what it is. Well, I appreciate that.
Okay.
Let's answer a quick email question before we go to break. What do you say?
Sure.
We have a show coming up on this soon. This person was just in a car accident. They had painkillers prescribed and physical therapy, still in pain. Can chiropractic help what they think might be whiplash?
You know, what I love about our work, I still think when you're in a car accident, the neck has to be misaligned, even by a slight jolt. Our society says take painkillers to numb it. Physical therapy says do exercises to strengthen the neck muscles. But the missing component is if the vertebrae of the neck is misaligned. That's where I feel that our niche in the market is to gently realign the vertebrae. And there again, it's so exciting when someone says, I tried 5 different pills, I tried 2 physical therapists, and in 2 weeks, I feel better here than I did in 6 months of that care. So that's where at the Wellness Center, we're all working more as a team. So these car accident patients will see the physical therapist, but then they'll see the chiropractor, and that to me is the best of both worlds for them.
Great. Quick break. When we come back, we have more summer tips for you, including what kind of footwear you should be wearing. Everyone wears flip-flops. Does that give you enough support if you're walking all day in a park, for instance? We'll talk about that after the break. drjohn@epix.net, the email address you should send your questions to. We'll be back. Teach you some more tips for the summertime right after this. Tips keep you healthy this summer. That's the topic on this edition of Let's Talk Chiropractic, and a lot more to get to. We don't have a lot of time, so let's get to it. Here's another one. Another tip is that, you know, in the summertime, people just tend to keep going and going and going, and they do things outside, and they're not getting enough sleep.
True.
You find that a lot?
Again, Rick, I think this time of the year, when the weather's nicer and people want to get more active, Rick, do you ever overdo it? Where you're doing yard work all day long, and then you go to bed and you just can't shut it off.
You're overtired, they say, yeah.
And I think that if you can say to your body, I'm a little bit out of shape, I should not be doing 8 hours of yard work today. So there again, take little breaks, you know, pace yourself. I'm the kind of guy, I always tell my kids, one of my mantras is, work first, play later. So I'm always trying to train my kids, get all your chores done first, and then play. But yet, at the same time, there's a limit to say, let's not overdo it so that you can get proper rest tonight.
Good tip. Proper footwear is so important. And this time of year, you see people, number one, in flip-flops. Especially, I always say, at the amusement parks or, you know, just walking around. Do they provide enough support for you?
They don't, Rick. I always tell women this. If you're going to go, like say to church or somewhere you're not going to be walking a lot, then you can wear flip-flops or even high heels. But if you're going to be going somewhere where you're going to be doing a lot of walking, Rick, people, they take enough money, sunscreen, they look at how but I think their feet, they just think, let's throw on whatever shoes. And then halfway through, say, whatever park they're at, and they're walking for hours on that hot concrete, then their feet are killing them, Rick. And I've seen long-term plantar fasciitis, you know, tendonitis, all these itises, inflammations of the feet. So take care of your feet. Wear a good arch support. They have sandals now that have orthotics built in them. I always wear white socks and sneakers because I just think it's more cushioning for my feet. So flip-flops are fine around the house, but not if you're going to be walking in a park like all day long.
Here's another thing, and you say around the house, but I'm probably just as guilty as any, and that's just going barefoot around the house. Is just walking around your house on a regular couple hours every day, could that do some damage?
It depends. For example, if you have carpeting throughout your entire house, then going barefoot is fine. This is the time of the year, you know, part of my analysis is I check the length of their feet. So and so many people have literally cracks in their heels and they're bleeding. And when I ask them, sure enough, they have a hardwood floor, they have a tile kitchen, so they're walking all day long barefoot. So again, if your feet are being pounded all day long, Rick, you know, and something hard like that, at least put lotion on them every night. There's different creams you could buy, but don't let your heels crack from going barefoot around the house all day long.
Arch problems too, I guess, and things
True,
like that.
You get flat feet, so that's why I said, Rick, I would think, I'm not in the habit much of doing it. I guess I wasn't raised that way. We always sort of wore something, but it's good at least to wear like different shoes like we talked about before, just to get some arch support. It doesn't have to be real warm to keep cool, but arch support's important.
Okay, great tips tonight.
Practical tips. I think this time is something for the beautiful summer.
I totally agree. I totally agree. Some people can do every day, and that's what it's all about. And if you want to get in touch with Dr. John Degenhart, we invite you to give him a call. 454-2474 is the phone number at the Degenhart Chiropractic Health Center. That's located on East Broad Street in Hazleton, if you'd like to stop by and visit as well. And we thank you for joining us as always.
Thank you, Rick. Enjoy the beautiful weather, buddy.
Enjoy the beautiful summer. I know I will, and I hope you do as well. And we'll see you next time on Let's Talk Chiropractic right here on WYLN. Chiropractic for children? I mean, could it really be beneficial to an infant or a little baby? I mean, that's what we're going to talk about tonight on this edition of Let's Talk Chiropractic right here on WYLN. I'm Rick Marticelli. You know, in shows past, we've talked about how chiropractic can be good for seniors or middle-aged folks, or people of all ages, but we've never really talked about infants and children. And that's the topic of tonight's show. And we're going to find out if it's safe, why they need it to begin with, and we're actually going to see an adjustment. We welcome to the show Dr. Stacy Sando, our expert on this topic tonight.
Yeah, I should be by now.
You should be, especially because this is the first time we're talking to you since you had a new little one, right?
Right.
Tell us about that. Everyone wants to know.
I'm so excited to be back, you know, sharing my experience with everybody in the audience tonight. I had my son Dominic 2 months ago, and you know, it dawned on me, my first show back, Dr. John's away, what should I talk about? And I thought, why not talk about adjusting infants and why there's such a need for chiropractic care with children and infants.
It's a pretty cool topic, and not only will we talk about it, but we'll actually see it. And we're going to do an adjustment here on Dominic in a couple minutes on the show, and we'll actually see what happens. First of all, we have to understand why it's necessary, and we're going to talk about that after the break. So if you have any questions, we invite you to email them to drjohn@epix.net. That's drjohn@epix.net. And we'll get into it right after this. We'll find out why chiropractic beneficial for little children right after this. Hi everybody, welcome back to Let's Talk Chiropractic right here on WYLN. If you're a parent of a newborn or a child, even if you're a grandparent and you have little ones running around the house, this show's for you because we're going to talk about how chiropractic can be beneficial to those little people, if you will. And kind of I want to talk with you to get started is how you got interested in this, because I know you're a parent of 3 now.
Right.
But was there an interest in adjusting children even before you were a parent for you?
Yeah, I think it started when I was a child. You know, I think we've said before on the show that I've always wanted to be a chiropractor. Even when I was little, I got my first adjustment. I was 6 years old, I think. And Dr. John gave me my first adjustment.
Oh, yeah?
So, you know, from that age on, always, wanting to be a chiropractor and then going to school and taking pediatric adjusting classes, that were part of the curriculum, I chose to, kind of go a little further with it. I remember when my sister had her baby, the first baby in the family that was born, I drove home from school that day and made it there late at night, stopped at the hospital, and I was holding this little tiny precious baby in my hands, and I thought to myself, how would anybody know if this child was subluxated, if he had a misalignment in his spine? He can't tell you. Nobody could speak for this baby. So I asked her if I can check him, and I did, and I was telling her what was going on. And she was amazed. How can a baby be misaligned? He's only a day old. Is it possible? But it definitely is.
So you get special education in school for children?
Sure, they do have special classes that they teach you, and you practice on little dolls first, and then they actually bring children in, and everyone's goal in our clinic in the school was to try and get a family with children, so you can learn that way too, and it's an amazing process.
Well, honestly, I guess when people think about chiropractic, they think about adults, number one. Number two, they think about headaches, they think about back pain. But how does that tie back to a child, I guess? Why does even a child need this to begin with?
Well, it's kind of all about prevention, right? You didn't wake up one day and just had headaches caused by your neck being out of alignment, or you didn't wake up one day and ended up with 3 disc herniations in your back. I think we've talked about the show a number of times that things happen over time, and they've actually found that by 17 years of age, a child can have 7,000 traumas. Whether, you think about children, even infants, you're taking the onesie off and their head whips back a little bit, or you're holding them on their shoulder and their head whips back a little bit. You change their diaper and you're bending their legs up all the way, that's one way a child can get subluxated, besides what happens in the womb. And also toddlers, on the monkey bars, running headfirst into the couch like I used to do, or sliding down the steps.
Even the delivery process, could that cause a subluxation?
Yes, it definitely can. And I think any woman that goes through, childbirth could really understand that, because it is a traumatic experience for the baby. The mother's pelvis has to crack, so the baby's head can fit through, and when the baby starts coming through, the doctor actually twists and catches the baby. So there is a lot of pressure on the neck, and the way it is, if the cord is wrapped around the neck, that also puts more direct pressure on the upper cervical spine, which we've talked about too is very important, just because of the blood supply to the brain and the nerve supply. Another
thing I'm thinking of, and you kind of touched on it before, and that's like, how would anyone know if there's something wrong with the child? So is this more of a preventative thing, or are there things parents could look out for that maybe could be a warning sign that maybe something is wrong? You know what I'm getting at?
Sure, exactly. There are warning signs, and I think even with my own son, I noticed in the beginning, I'd put him in his car seat and his head would go this way. And we'd prop his head up, it would go back down. So, that's one side. If the head's always falling to one side or resting to one side, that's one sign. Children with colic, they can have misalignments. GERD, where they're having reflux, they have misalignments most of the time. There's many symptoms with infants in that area. We've also seen children in our office that have torticollis, which is when the muscle on one side of the neck is so tight that their head is actually positioned in a twisted manner. A couple adjustments, 3 adjustments, and their head is straight. They're laughing and gooing like a normal child, like a child without a subluxation should do.
Let's talk a little bit about how the adjustment itself differs from what you would do to an adult. If you can talk through it. I know we'll see the adjustment later on Dr. Stacy's new son, but let's talk a little bit about what actually you're doing differently than if you had an adult on the table.
Well, first of all, the baby can't speak, which we've talked about. So, the palpation is, the feeling of the spine or the palpation is a little bit more in depth, and sometimes we go through range of motion with the baby. The adjustment itself, you would think, we've always talked about in our office how we like to be gentle. Well, with adjustment with a child is even more gentle. You don't have to crack a baby's spine because some of the bones in the spine are cartilage. They're not fully formed, so you can't really crack it. They're mostly pressure points and holds, sustained holds on the baby.
Is this safe? I mean, there's probably a lot of parents out there thinking, I don't want anyone touching my baby like that. That's probably the biggest hurdle to get across here.
Right.
How safe is it? Talk about safety a little bit.
It is very, extremely safe. Trust me, I would not do this on my own child if it wasn't safe. I am a little bit of a fanatic of a mother. But no. I adjusted Dominic the second he was born. The cord wasn't even cut. My husband wasn't done cutting the cord. They propped him up in my arms, and I checked his spine and adjusted him. The same thing with both of my children. So it is extremely safe. Like I said, you're not twisting and turning the baby. It's probably safer than half the times when people change the baby's clothes. You know.
But are they more fragile than an adult? In some regards?
In some regards they are, and in some regards it's almost better because they're more flexible. So they can take a little bit more motion than an adult could because they have that buoyancy in their spine. But
so does the adjustment hold on them better?
Yes, well, and there's a difference there as well, that the adjustment itself, you don't always need to adjust a baby. You know, they might come in and you might find a little bit of a misalignment, but you leave it go for like, you check them again in a week and it's gone because the bone can move in and out. So, and we've said this before also, you know, the job of a good chiropractor is to know when to adjust and when not to adjust.
Right. You see a lot of children in the office?
We see quite a few, yes. Yeah. And it's great to see them. It is.
Is it a common thing? Do all chiropractors see children? Is it a specialty of yours? Or?
I know all chiropractors would love to see children. I think I could speak for most chiropractors out there. But I would like to specialize my practice as much as I can with children.
That's pretty neat. So I guess we'll take a break, and when we come back, we'll take a look at the adjustment, huh?
Sure.
It'll be pretty cool. We're going to take a look at an adjustment on a 2-month-old. Yeah, you're going to see, it's pretty cool. You're going to see right here in front of you, and you can see that not a big deal. It's not going to be painful, not going to be dangerous at all. And if you have any questions about it, we certainly invite you to email them to us. Here's the address, drjohn@epix.net. There's the address on your screen. Anytime about any questions about anything that has to do with chiropractic, we'd be glad to have them. 2-month-old Dominic Sando coming up. I'm sorry. You're right. Coming back right after this. Stay tuned. Hi everybody, welcome back to Let's Talk Chiropractic here on WILN. And topic of our show tonight is chiropractic as it relates to children and infants. We're talking about why it's beneficial for a child to be adjusted by a chiropractor. And right now we're going to actually show you what it looks like. Making his television debut, Dominic Catrone, 2 months old.
Yes.
Beautiful little guy there you got.
Yes, thank you very much. So a lot of parents, when they come in and they bring their child, they can't believe, they're all nervous, but they can't believe how quick and easy, you know, the adjustment can be. So I'm just going to go through and show you a little bit of like how we check the spine first.
Very cool.
So I'm going to lay him down here. I don't know if you can see him yet. I'll take my time. But as the baby lays on the table, a lot of times you'll see even your medical doctor will bend the legs and they'll check, you know, the hip joints, and that's just a natural thing that we like to check to make sure that there's no congenital hip disease. That's what it checks for, which is when the leg joints aren't formed properly up into the hip.
You could feel that?
You can definitely feel that. You can feel like that the hip just kind of slides out of the joint. So we check that naturally. If the parent doesn't want the baby laying or they're afraid the baby will fuss a little bit, we can always have the mother hold the baby. Dominic's kind of used to being adjusted, so I'm used to adjusting him, so if he cries a little bit, it's fine for me. But I'm trying to do it so everybody can see. You kind of just feel down their neck, and you can feel one side, a little lump, as opposed to the other side. Like I said before, some babies come in and their head's always twisted to one side, so that tends to be the side where the misalignment is. When we want to check their back, we can roll them over, and we can lay them on their side and just feel down their spine. I should do it the other way, actually.
Hi, buddy.
He gave you a look.
Yeah, he did.
But you can feel down their spine and just see what you're feeling, if anything's moving. You can see he gets kind of a little peaceful at this time. He kind of likes it. It's a little massage for a baby, and infant massage is wonderful. It gets the mother bonded with the baby, and it also, you know, helps the baby tremendously because they're a little sore from going through their everyday trauma. Another way we palpate, like I was saying, they're flexible, and you want to feel the motion in their spine, so you can bend them up. He likes this part. You feel the motion in their lumbar spine. We do this for children that are having some bowel problems. Okay. So you can actually, if they're a little bit blocked up and you feel the motion in their lumbar spine, there's always something that's a little fixated down here. Now the adjustment itself, and I'll sit him up to show you, because he always has an atlas, that's first vertebra that's misaligned on the right side. And all we do, if you can see my finger, is I hold a little pressure here for a couple seconds. And he usually gives a little grunt. And he's done. That's really it for an infant adjustment. And there's
just a little bit of pressure like that makes a difference?
A little bit of pressure, yeah. It's kind of like if you were just, you know, washing a plum off or something.
Yeah,
it's really, it does make a difference. And you know, you can go back, we always wait about 3 to 5 seconds, maybe even, you know, 20 seconds, and we double check, and he's fine.
So you can actually feel a difference before and after from a chiropractic.
From a chiropractic's point of view, you got to remember, we're trained to feel the muscles and the bones of the body, any type of inflammation or, you know, changes in the joint. So you can definitely feel. Now at the office too, we have an instrument that we use for children. That will actually, we use for the upper cervical spine, and it tests the heat differential from side to side behind the ears of the first vertebra.
And why would that be different?
Well, sometimes what happens is when the atlas misaligns, well, it's all the time what happens. When the first vertebra misaligns, which is what happens with most children, it's hotter on one side, the side that it's misaligned to. And they found that through some research. So when we hold the pressure point and you retake that heat reading, what happens is it balances out and the heat reading's even on both sides. So you can actually see, like on paper, that there has been some change.
That's wild.
Yeah.
Now, let's say, for example, that Dominic didn't have an adjustment for that misaligned top vertebrae, the atlas. What's going to happen to him as years progress?
Well, as the twig is crooked, so grows the tree, right? You know, if that's left, you know, misaligned or subluxated for years to come, he might grow up getting headaches, going through a growth spurt, getting scoliosis. He might end up, we've seen major differences with children that have ADHD, changes with children who are autistic. Not that it's going to cure that, but we've seen really good changes where amazing, I think we've talked about the other time, where they've been a little bit calmer, they could sleep through the night, ear infections. The first thing I do when my child has an ear infection is I usually adjust them.
Really?
You know, maybe even twice a day, depending. I'll check them in the morning, and if I check them at night and it's back out, I will adjust them again.
Say you find something wrong in the lower part of the spine. Is it just the same thing, just the pressure point, or
it is the same?
Or is the adjustment what you actually showed with the moving of the legs? Well,
that can actually adjust the spine, you know, naturally. If you don't feel like there has been a change, you know, you can hold pressure to the one side. He had a little bit of blockage when he was about 2 weeks old, where he was having trouble going to the bathroom, and he actually did have a misalignment of his last lumbar vertebra, and I just laid him on his side, and I just held him in this position for a couple minutes with my finger, and you can see right on his little dimple there, I would hold it, and lo and behold, about a day later, he was pretty much regular.
So this is never painful.
No.
I mean, if a child's crying, it's because it's just...
Right, it's because a stranger's holding them, or they're hungry, or, you know, he's not in pain right now. You can tell he's kicking it and gooing at you.
That's pretty happy to me. And that doesn't happen when many children look at this mug, I'll tell you right now. Here's another important question, especially with the economy and the way things are today. Does insurance cover this for kids?
For some insurances do cover it. We do have family fees in the office, so if the parents are getting adjusted, you know, the children are usually free. So it just depends on your situation. But, you know, I feel, and Dr. John also himself feels, that getting a child adjusted is very important. So we would never, you know, put a boundary up for someone to come with price.
Right. So you can just come with your child and your appointment at the same time. They don't need a special appointment. Is there a special table or anything you use?
No, actually, like I said, the mother can hold the baby, or, you know, usually in the office the mother holds the baby, or we put them in their car seat, or I lay them on the adjustment table. And the mother holds them, you know, steady while I check what I have to check.
We're keeping Dominic awake.
Yeah, I know he wants to go.
I think we better take a break so we can put him to bed. What do you say? We're going to take a quick break, like I said. If you have any questions, you can certainly call them in as well. 454-2474 is the number for the Degenhard Chiropractic Health Center. And when we come back, we're going to continue talking about children, but some practical tips that you can use to make sure that your children are on a path toward wellness as far as the spine and neck are concerned. We'll talk about that right after the break. Welcome back to Let's Talk Chiropractic right here on WYLN. Our topic tonight is children in chiropractic, infants in chiropractic. And getting back a little bit to why it's necessary, I guess a lot of physicians out there might think if a child's experiencing pain, they might say, it's just a growth spurt. Nothing to worry about. Your comments to that would be what?
Sometimes children do go through growth spurts. I have no doubts about that. I mean, they grow. But a lot of the times a child will come in and they've been to their family doctor, the mother doesn't know why the pain continues. A growth spurt should only last, a week to 2 weeks, the pain from a growth spurt. And then again, it's usually on both sides. If it's pain only on one side, like one knee, we tend to check their spine and find that their pelvis is out of alignment. The pain in the knee goes away. So growth spurt maybe, but most importantly, if their spine is out of alignment when they go through a growth spurt, that's how scoliosis starts.
Another thing dawned on me actually while we were talking during the break is that if a child's born with a hearing problem, they might live their whole life and not know they have a hearing problem because it's the only way they've ever known how to hear. So is this the same thing with pain? Could a child live with pain for years and not know that they have pain? You know what I mean? Right.
If it's something that they're constantly, used to, just like some children are raised, on soy milk. They don't know the difference between soy milk and regular milk. I've had patients come in, high school kids or even adults come in and they're coming for low back, and we check up their spine and we say, you have a misalignment in your neck. Should we take care of that too today? And they say, okay. You adjust them, and they don't even realize. They'll literally say to you, wow, I never even knew that hurt until now it feels so good.
Yeah.
So an adult can be that way. Of course, a child can be that way.
Okay. Whenever we talk about kids on the show, we often talk about scoliosis. And so let's talk about that a little bit. Could these preventative adjustments have an effect on scoliosis and preventing it?
Sure. There are two types of scoliosis. There's a functional scoliosis and a structural scoliosis, okay?
And scoliosis is
a curvature of the spine where actually, and I'll show you this right here, the spine itself should be, if you look on it straight on, should be straight. What happens with the scoliosis is you get a curve.
Oh.
Okay.
From side to side?
From side to side. So, you might look at someone and their one shoulder will be higher, their other hip will be higher. They probably have somewhat of a scoliosis. What happens is most scoliosis, well, all scoliosis start out as functional. Whereas, there's a misalignment in the spine and one of the muscles is shortened or lengthened because of it. And the body itself, as it grows slightly crooked, just like I said, so grows the tree, crooked. Yeah. That is a functional scoliosis. If you catch it right away, make the adjustment, the muscle spasm in there relaxes and the spine can straighten out.
Okay.
If it is not caught, then what happens is the spine starts to curve more. You'll get an extra curve to compensate, because the whole goal of the body is to keep the eyes level, so you'll end up with a full S curve and it becomes structural, which means it's really at the point where you can't get full correction out of it. You might get some, but not full.
Okay, that's when you need surgery.
Well, no, surgery is only really for people that have a scoliosis of 27 degrees or more.
Oh.
Okay? So not everybody needs rods and all that. But you can see, if you've ever seen someone that's older that has a scoliosis and, their spine's a little bit twisted, that's because they had a functional one that wasn't taken care of.
Okay. 30 seconds. We want to talk a little bit about prevention. Tips for parents that they can do to prevent problems for their kids. What could they do?
Well, number one, infants themselves, changing their diapers. We tend to lift straight up when we change their diapers. That can, even though you saw me doing that with the adjustment, it's not a chiropractic adjustment when you change a diaper. It's better to turn the legs to the side a little bit and wipe from the side. Also taking off the onesie for even toddlers. Don't lift the shirt with both their hands over their heads, and you ever see a shirt get stuck?
Yeah.
That can cause a little misalignment for toddlers.
And don't sleep on the stomach.
Don't sleep on the belly, and one pillow if you're going to sleep, and watch the Nintendo backs or the Wii backs.
That's the best advice of all. Don't sleep on the stomach. We've said it a lot. Thanks for the tips, and thanks for bringing your little one in.
Oh, well, thank you.
Congratulations on that. And thanks for watching Let's Talk Chiropractic. We'll see you next time. Take care. Let's say you're injured in a car accident or injured while you're at work. What should you do? There's a lot of questions you have, a lot of uncertainty, and you just don't know where to turn. Well, we're going to answer some of your questions right here on Let's Talk Chiropractic tonight. I'm Rick Marticelli. We're glad you joined us. I'm here as always with Dr. Stacy Sando and Dr. John Degenhart from the Degenhart Chiropractic Health Center. How are both of you?
Wonderful.
Great.
Doing well?
Very good.
Fall treating you well? We told everyone how to be healthy last time, after all.
Never treat you well.
That's a good point. Is autumn treating you well?
Autumn is treating us wonderfully.
That's good. That's good.
I think because I grew in this part of the country, but I enjoy the change of seasons.
I do too. It's
So I'm
nice.
looking forward to a nice, cool fall.
I've never experienced the whole summer in Florida, but they say you don't get used to that heat. I don't know. So 4 seasons, we'll take it, right?
Right.
That's true.
Mountains.
We have a lot of tips for people tonight too as well. Injuries at work, with a car accident, things like that. People do have a lot of questions. You're going to kind of talk about what they should do if they experience a problem.
Though, Rick, you and I have talked about this show in the past, I just thought it was a good show to bring up because unfortunately people are always having work-related injuries, car accidents, and they come in our office, Rick, if it's their first car accident or first injury at work, they just don't know what are the rules.
Yeah.
So I thought, let's go over the rules as to do I need an attorney, when do I need to see a chiropractor, just to educate the public.
Sounds good. We'll do car accidents first right after the break. If you have any questions, we invite you to email them to us, drjohn@epix.net. That's the email address. And we come back, car accidents, tips for you, what you should do if you're unfortunately involved in one. Stay with us. We'll be back. Welcome back and thanks for tuning in to Let's Talk Chiropractic right here on WILN. Our topics tonight, car accidents and injuries at work. Some tips for you on what you should do, your rights, your responsibilities, things that could make you feel better in the long run. So let's start with car accidents and let's just take a scenario. Let's say you're involved in a car accident. What is the absolute first thing you should do?
I usually recommend always go to the hospital. I mean, the option is there for you. Go get the x-rays, have them evaluate you, make sure that there's nothing more serious going on. Remember, they say research has shown even an accident 5 to 7 miles per hour can cause more damage than one at 60 miles an hour.
Really?
They've done research where they've put people in cars and geared them up, and I don't know who signed up for that. But they have found with that research project that can happen. So get your x-rays, and then from there, see what you need to do next.
Let's say you're experiencing pain despite having x-rays that come back negative. Chances are you're going to be given a prescription for some sort of medication for that, right, Dr. John?
Right. Most patients will go to the hospital, Rick, and they'll come to our office, and they're given a script for, say, muscle relaxers, painkillers, maybe anti-inflammatories. But the doctors overall will say it's just a soft tissue strain. And the patient will say, I could tell it's more than just my muscles. Mm-hmm. So on our x-ray, Rick, we look at an x-ray, maybe you'll see the vertebrae, let's say it was a whiplash. Mm-hmm. The vertebrae are misaligned, and you feel, yeah, doc, the patients can feel the bones misaligned.
Really?
So when you get them to realize that only the chiropractor, our specialty, is to palpate, which means feel, and look at an x-ray to see what's misaligned. So all too often in a hospital, x-rays are taken to see if there's a fracture, maybe even cancer. CAT scan or MRIs might be taken to see if there's any kind of tumors, but to actually see the misalignment, right, that's the biggest missing ingredient of when you go to a hospital. So Stacy's right, you go to the hospital, but they don't detect the real problem.
Okay.
So then they come to us. So our dream is to try to get patients that are ever in a car accident, at least go to a chiropractor once to make sure that things are put back in place.
Is it possible that, say, after a car accident, you're not feeling any problems, then a couple months down the road you might experience some symptoms from that car accident that happened weeks and months ago?
Sure, they say up to 2 years after an accident, problems can start occurring. Remember, at the time of an accident, your body's pumped with a ton of adrenaline. So, and that can last for a week even. And then from there, your body can compensate. So some people have come in 6 months after a car accident. I don't know why I'm all of a sudden getting these headaches. We take an x-ray, their vertebrae's moved out of alignment, and we can always correlate it back to that accident.
Mm-hmm. Dr. Jean, does every car accident result in a subluxation, a problem with your spine?
Not every. I think there are sometimes, I would say the majority it does, but there are some accidents if the patient's really in good tone and maybe it's not, and Stacy was right before, it doesn't have to be, Rick, like a 30-mile-an-hour accident, but there are a lot of times I'll tell the patient, they'll come in, I'll check their leg length, it's level. Muscle tone's good, palpate good, I say thank you. At least we checked your spine, but that is the minority. The majority of people, as you just said, they take their painkillers, so they numb their pain, and then they come to us 6 or 8 months later, and then it's very hard to call that insurance company and say that the headaches, the dizziness, the numbness in their arms today is due to that accident way back then. The car insurance looks for what they call a trail of care. So if I'm in a car accident, I go to my medical doctor, I take his pills, but then I stop seeing anybody because I'm just taking pills. And 6 months later, then I go to the chiropractor. The car insurance is afraid of fraud. They start calling me saying, well, how do you know that this guy didn't fall on his ice at home or didn't get hurt at work? And they're just trying to get us as a car insurance to pay for it. So that's why the advice is go to, as soon as you can, to the chiropractor. We will let them know, Rick, if it's good, don't get checked. But if there is something misaligned, which there normally is, start care so the car insurance won't have any doubts on what's going on.
Okay. Here's some questions that we have from people who have called in about car accidents over the week. And this person wants to know if their premium will go up if they seek medical care after a car accident.
No, the premium never goes up for medical care.
No?
No.
So if that patient, just to be the other advocate, if that person is the cause, Rick, of 2 or 3 accidents within 1 year, like say if I was drinking and driving, and I caused 2 or 3 accidents, then my premium goes sky high. But if I am hit by someone else 2 or 3 times, and I seek medical care, premiums will never go up.
Okay. How about this caller wants to know if you need a referral to see a chiropractor after a motor vehicle accident?
No, with an auto accident, you can go see whatever doctors you need to see. It's your call, your option. And then again, even if you come to us and we feel like you need something else, we can refer you for the X-rays. We can refer you to physical therapy or whatever we think you need.
Mm-hmm. How about the timing from the accident itself? You ever see people that have come right from an accident to your office? Do you have that? Really?
I think, Rick, people who are first-time car accident people who do the routine we just spoke of, they will go to the hospital. Maybe the second time. And Rick, after a while, I mean this in all respect to hospitals, but maybe the third. Remember, the average American is in about it's increasing every year, 5.8 accidents now per lifetime. So after the 3rd or 4th accident, Rick, I think they say, you know what? I'm going to go directly to my chiropractor because we have an X-ray machine. If we have to take the X-ray, we can see if there is a fracture. But the main goal, Rick, is they're tired of going through 10 X-rays, CAT scans, MRIs, medications, and then coming to us anyway. So a lot of people will now see us directly because they've been under our care before, and usually, again, you take that X-ray, you find it misaligned, Rick, and we can directly take care of them rather than having all of this other stuff going on anyway.
From the patient's perspective, the sooner they get there, the better the outcome?
The better, yes, because less inflammation can occur. You know, as soon as you get in there and the bone just moved out of alignment, we can get it back in, keep the inflammation down, keep the compensatory muscles from spasming up on them, and, prevent further injury. Because if you're walking around with the misalignment for so long, your body can actually, become more injured, and you can get more pain from that.
Another thing I wanted to bring up, and we talked about it before on the show, is that, when you have an injury, previously I should say, when we talk about medication and stuff, we're never bashing medication. There's a reason for it. And in this case, there is probably a reason for medication as well if you're experiencing pain. Talk about that a little bit.
My rule of thumb, Rick, is when you cannot sleep. If Dr. Stacy's in a car accident and she's unable to sleep, then I tell my patient, if the doctor, because people will say to me, I'm having a stomach reaction, or I'm getting constipated from my Darvocet. What do you think? I said, well, call your doctor. But if you cannot sleep, I strongly recommend you follow his advice. If they're sleeping pretty good, Rick, and their pain's not that bad and having side effects, I said, call your doctor, discuss it with him. My gut feeling, if it was myself, if I'm doing pretty good and the medications are giving me bad side effects, I would not take them. I would rather than let my body heal naturally, because if I'm able to sleep, because during sleep work, it's such a restorative healing process. And if the patient cannot sleep, I'd rather them medicate the body and sleep, which then helps our work to hold in position even better.
Okay, very good. We're going to take a quick break. When we come back, we're going to continue talking about car accidents. If you have any questions, you can email them